it's kind of nerve-wracking to do elective surgery, and it should be, it's a big deal. And so when they are kind of learning from each other and also seeing the benefits of patients that are, writing reviews or sharing their pictures, they also want to do it.
Hello and welcome to Beauty in the Biz, where we talk about the business and marketing side of plastic surgery. I'm your host, Catherine Maley, author of Your Aesthetic Practice, What Your Patients Are Saying, as well as consultant to plastic surgeons to get them more patients and more profits. Now, today's special guest is Dr. Shabnam Ghazizadeh, and she's an up-and-coming facial plastic and reconstructive surgeon in private practice with somebody in Newport Beach, California, and she's been there for the past 3 years. Now, Dr. Ghazizadeh did her medical training at Oregon Health and Science University, her surgical training at UCLA's Head and Neck Surgery Department, and she completed a facial plastic and reconstructive fellowship with Corey Moss as well as David Kim. And they're both facial plastic surgeons and part of the AAFPRS group. So Dr. Ghazizadeh, welcome to Beauty in the Biz podcast.
Thank you so much for having me. I'm excited to be here.
Oh, fantastic. So let's just start with, why facial plastic surgery? Why not plastic surgery or orthopedics?
I think it really just comes down to anatomy. In medical school, I actually was one of those people who decided very late. I don't have anyone in medicine in my family. And so it's really all about just exposure and kind of coming down the list and seeing what fits for what I'm interested in. And head and neck surgery and otolaryngology was the most interesting anatomy to me. The surgeries, the complexity was there. And then as I did my training, I just really liked the patients and the minute details that comes with facial plastic surgery, and especially rhinoplasty really appealed to me. So it kind of blossomed from there.
So I know you did your fellowship in San Francisco with two major facial plastic surgeons there, but then you ended up in Newport Beach, California, which can't be any more competitive other than, I guess if you went to Park Avenue in New York, but what possessed you to set up shop down there in Newport Beach?
Well, we knew we wanted to come back to Orange County. I went to UC Irvine for undergrad, and my husband's family's from here. And so that was always kind of in the plan. I did interview and kind of take a look at multiple prominent practices, including more in the LA area as well as down in Newport. But I mean, the competition is there, definitely. But I think that there's still space for, especially a female who's, soon to be double board certified. That certification happens this year. So we have to practice for 2 years, submit our operative reports, and then you can be double board certified. And so that there's still space for that there. And I think that the patients really kind of gravitate towards these centers where the big names are. And I hope to be one of those big names.
Right. So how much of your practice is facial cosmetic versus recon?
So my practice now is kind of multifaceted, but I would say about 80% is cosmetic, and probably 25% is more reconstructive.
Okay, so you joined another practice, but as a what?
Kind of in a more consultant role, as a surgical consultant, but just so I can have the flexibility to do things outside of my private practice, which I have. So I do work at Kaiser also, and that was really important in the beginning, first couple years, where I was doing a lot more surgeries that are reconstructive, but also, traumatic rhinoplasties. All the combination of the techniques used in those are so helpful for regular rhinoplasties and cosmetic rhinoplasties as well. And so I just wanted to stay busy. And I think that building a private practice, especially in a super saturated area like Newport Beach, can be hard. And so I wasn't willing to just sit around and do only marketing, which I spent a lot of time on. I wanted to be surgically heavy with volume. And so that was the model that I came up with, which I didn't know anyone who had that model, but since I have talked to other surgeons, and several of them have now adopted that model after talking to me, and it's actually not unusual now to have surgeons going into a Kaiser per diem role in addition to building up their private practice.
I'm hearing that more and more. I'll call it what's it called when you have a side hustle?
Mm-hmm.
I think you almost have to, when you're brand new at this, you're not just going to enter this marketplace and be busy, unless of course you do call, at night, or Kaiser. You must have gotten a ton of surgical expertise there, right?
Very high volume. And I've been really lucky with this practice to have kind of a unique model where I'm only doing facial plastics there. So I see very few general, and I do a lot of nasal trauma and rhinoplasties and secondary rhinoplasties. So it's been a really unique experience for me, but it's really built up my ability to be a better facial plastic surgeon and cosmetic surgeon in the end. So it's all kind of fed into the ultimate goal, and I've been really happy with it.
Let me just get clear about the business model of that. You joined somebody else's practice. He's an established practice. I won't say who it is, but it's established practice. And are you doing like a revenue share where it's all your staff, your thing, but you have your own space there? How is it set up?
So I joined his practice in the way, just their everything. And so, yeah, it's kind of a revenue share, but I, I, I guess it's like a surgical share. So kind of eat what you kill more.
Okay.
So whatever surgeries I do and I take in, that's the shared model.
And then part of that expenses come out of part of that? That's the
Yeah.
share part?
Yes.
Okay. And whose staff is it? Is it yours, his? Did you bring in
His
your
staff.
own?
It's the faceology staff. It's our shared staff. We both use the same staff.
Okay. Did you have any say in that? Do you wish you had your own coordinator? How is that going? Because staff can also be, I don't know, sometimes they're just more loyal to the person who, brought them to the party.
Yeah, I mean, that's true. Luckily, we have a really great partnership. We have a good symbiosis. I think it's kind of rare for two facial plastic surgeons to be that way. I really think it has to do with the personality. And I did interview with several, and I had multiple offers, luckily, when I was coming out of fellowship. And I think personality is the most important thing with choosing a partnership. And it's very easy to get into this kind of hierarchy where you're, the younger one, where it doesn't really matter if your schedule fills up. But as long as you have a shared goal and it's someone that you get along with, great. And me and Ray get along very well with Dr. Lee. So, I think that he remembers and recalls. I feel a lot of us maybe forget later on down the line what it was like to start off and try and build and try, be hungry and I want volume. And so he's very reasonable. And I think that he also doesn't, when I approach him with new ideas, which as younger surgeons we're just trying to figure out what's the next thing to do, how to stay busy, how to start thinking ahead and making sure we're not losing volume or losing momentum. He's always open to ideas, and so is our practice. So we're really lucky with the model that we have. It works really well for us.
And what about the marketing side? Who's attracting the patients? Do you have to attract your own? Does he share patients with you? Do you have like a model where if they're not a good patient for him, he passes them to you? Any of that going on?
Yeah, you do. You have to do that. If you don't, then it gets a little bit head to head, I would say. So I think you have to be looking out for each other a little bit. We refer back and forth. He has an Instagram and like a following that it's very different. I would say it's very niche. He's been in the area for so long and has done so many surgeries that he has this following of people who've been following him for so long, and then they eventually come around to surgery. And we're at different price points in terms of our surgeries, and so that kind of attracts one patient towards me or him. And then I do my own marketing, and my patients who find me on Instagram, they're all age groups. I have like 65-year-old females that are coming to me for a facelift, and they're kind of like surprised that they chose a surgeon based on Instagram, but it's becoming such a big part of marketing and they get to see your personalities. And so those patients that come to me through my account are very loyal. The ones that come through his account are, obviously loyal to his recommendations. So if he refers to me for certain procedures that I do, like transconj blepharoplasty, lip lifts, rhinoplasties, hair transplants, things that he doesn't do, then it's a kind of an easy transition between the two of us.
So, just out of curiosity, did it get all legal? Is there a non-compete? Did you sign papers? Is this more handshake kind of thing? Can you come and go?
We have a contract. Yeah, we have a contract of, kind of stipulates the things that are, making sure that we're doing this and no one's screwing the other person over. But yeah, it's also a kind of a trust thing. And so you have to have a good partner who that they're going to be forthcoming and their tensions are good and honorable. And so it's a combination of the two in the model that I have right now, because I am an independent contractor. I can do anything, but I'm choosing to grow within our practice, which, it also has my best interests at heart as well.
And is there a surgical suite within the practice?
It's a separate entity, but yes, it's associated with our practice, and we're the only two surgeons that operate there.
Oh, nice. So you still operate at Kaiser as well and there as well?
Yeah. Yeah, only I'm very, very few at Kaiser. I would say just the really reconstructive, complex cases with the general ENTs refer to me. But really, it's now that the private practice is more built up, it's really focused on the cosmetic patients, and I do still offer the reconstructive within my cosmetic practice. Not that I don't do it, but we have our cosmetic. You know, you have to go through our cosmetic practice to get to me at this point.
And then you have your own website, I saw, your own Instagram. So you really are your own entity within another practice. Yeah.
Yeah, yeah. And that's the way I wanted to set it up because I'm basically positioned to do what makes the most sense, financially, but also in terms of my patient care, making sure that, I have a model that I can do and treat and care for my patients however makes the most sense to me. And then kind of see where it goes in terms of volume.
Yeah. So tell me about the non-surgical side. I know you're a surgeon who wants to do surgery. Do you find that it's really helpful to offer non-surgical to that patient who's not ready for surgery yet, or what's your opinion on that?
Yeah, I think it really is. I think that my surgical patients, I do some non-surgical things afterwards. My non-surgical patient, I end up just surgerying afterwards. They really go together. I think it's hard when you have a higher volume practice to really make space for the injectables. And so it's very easy to want to hand them off. But there are some loyal patients they want your expertise. They trust your hands. I had a patient today who flew in from Toronto who had a lip lift with me, and then she's back for a post-op, and then I did her lip filler, and she was just like, "So I have to fly here for you to do all my injectables now. This is kind of like, I'm going to have to do this." And so when they see what you're capable of as a surgeon, the person who understands the tissue and the anatomy the best, they still want to stick with you, and it builds loyalty and trust. And I think that they also see your expertise. You have like kind of a vision for the whole face, not just how do I use the most injectables in this patient. And so I'm the kind of person where my goal is to make natural, and so I'm not going to just use the whole syringe because you purchase the whole syringe. It's kind of you're going for the artistic eye of this is what looks best on you and your proportions. And so I just, I think that my patients trust me. And so I have to keep going with it, although it's a little tricky when you're getting busy surgically, you don't have as much time for it, but I think they really go together well.
I wonder if age actually works to your advantage at that point because you have like the new, latest, innovative techniques versus old school. I don't know. Does that have any play in there at all?
I think it does. I think I think we're learning so much more from all these social media avenues, and so we're seeing more what everyone does rather than looking at all the old papers that, they described something 20 years ago. I think that, it plays into your perspective a little bit. And even the fillers that I use right now, I'm using a lot of RHA, for example, which is not an old school filler. It's just got, approved here in the US from Europe. And that's my favorite filler of the face right now. I still use other things for other areas, but those are all kind of the things where you're learning from the people around you and the people that you're following on these platforms, and you're staying ahead. And also, I went to very top programs in my fellowship and UCLA, who's #1 in head and neck surgery right now. So all those things I think play into getting kind of a really fresh perspective that I think Newport has space for.
Right.
Yeah.
And what about the patients down there? Let's just talk about anesthesia because that seems to be a hot topic lately. A lot of the surgeons are doing in-house as much as they can under local or IV sedation. What's your feeling on that?
We do IV sedation for all our surgeries and facelifts. I
Nice.
only
Nice.
do general for my rhinoplasties.
Hmm.
I I'm always going to do general for my rhinoplasties. There's no there. I just find it too risky,
Right.
knowing all the possibilities. But with our facelifts, my deep neck lifts, basically everything we do IV sedation, and it works really well. And I am always surprised, but on day one when the patients come back for drain removal, they're feeling great. Like they're not nauseous, they're not complaining of like a tickle in their throat because the balloon was too inflated. They're not feeling like wonky and woozy like they do after general anesthesia, where they're kind of out of it for about 3, 4 days. I would say they're just kind of like not feeling like themselves. And so I mean, for these longerish procedures, it's really great to have patients who feel refreshed, and I think that they notice that, hey, that wasn't that bad. And we have patients where Lee did a facelift, and then 2 weeks later they're doing a lip lift with me because their recovery was so smooth that they're like, oh, I'll do my lip lift now. I'm really excited.
Yeah. I've had both, and I'll take IV sedation any day. Just like for what you said, I can bounce back so much faster, and I feel fine. That I have woken up from general anesthesia just like a Mack truck hit me, and I just love. I don't know why you wouldn't. I don't know what the downside would be for IV sedation. I think it's just. I think it's the well, I should say whomever is good for, as long as the patients are okay with it. It's so great that you have the choice nowadays, you know?
You do. I think you have to know someone who knows what they're doing with IV sedation, not over snow them and get into issues. So, a team that's been doing it very often, but also you have some time limitations with IV sedation. So I think that if you're going to do a long, 6, 7, 8 hour surgery, you probably should be doing general. If you're doing anything under 6 hours, that's IV sedation is a good option for the right patient. But I think it really depends. A lot of times now you see all these big transformations where they did like brow lift, bleft, CO2 laser, lip lift, facelift, neck lift, and all these other things, the fat transfer. And it's like that is a very long surgery. And so that should be under general. So I think a little bit depends on all the factors.
Yeah, for sure. I notice if we were talking about differentiating, I know you really seem to have a mark on the lip lift world market. How did you do that, or is that like your favorite procedure, or where are you going with that?
I really like it. I think it makes a big difference in the aging face, and not something that everyone notices. And so it went really nicely with Dr. Lee's practice because he does primarily facelifts and neck lifts only, and he didn't do lip lifts before I got there. And that's one of the things that
Oh,
we brought into the practice, that I brought into the practice. And I think the patients are really seeing the difference. I have a lot of patients that do just lip lifts, but then also ones that do aging face with him or aging face with me, and without it, you kind of don't get that youthful change in the proportions of the mid face like you would. Like from the side angles, the facelift makes a big difference. But from the front, sometimes, unless you have a really big double chin, you're not seeing the big change. And that's where the lip lift comes in. And so I use a deep plane technique for my lip lifts, and I do corner lifts as well. And I've really found that. The patients are surprised themselves, that he recommended or I recommended, and they do, and they're like, wow, I didn't even realize how much that was aging me. And it's really a nice procedure that goes well with all the other things that we do for rejuvenation.
I've been going to the meetings forever. I swear I never heard lip lift until, I don't know, 4 years ago, maybe. And now I hear about it all the time. And everyone I know has had one. So
Yeah.
I'm glad somebody figured that out because it really does affect the symmetry of your face. If you've lifted everything else and not the lip, you're off, you know?
Yeah, the proportions are really important there. I think the technique has changed. It was described in the 1970s, but it was really a skin only technique. And I've seen surgeons do skin only techniques too. You really don't realize until a couple of years down the line why that's bad, is because it starts to migrate and the incision widens. And so the deep plane technique, or like the deeper suture to the ligaments of the nose, really help that central incision stay tight and also get the best scarring possible.
Right. So let's talk about you hitting the marketplace. So here you are, you're new at this, you enter up somebody's practice. How the heck do you even get started with the marketing?
I think reviews, and that's something I'm still continuing to build, but I have like almost 60 reviews at this point, of 5-star reviews. And so I think I was shy early on. My husband would be like, well, just ask them. I'm like, no, I can't ask them.
Yeah.
The MA has to ask them for the review, or like, they have to ask them to do the pictures. I can't ask them. It's like, it's not something that you're comfortable with. You don't want to put your patients like out or like ask too much of them. You're you're just trained under like HIPAA and all these things where you're just trying to keep everything, really secret, and patient physician relationship. And so this is kind of outside the realm of what you're typically thinking of as your physician, to have a conversation with the patient of, would you let me share your photos? Can I get a review? Like all these things are not things that we're trained to do. They're actually the opposite of what I'm trained to do. And so that it took a while for me to start kind of asking, but the patients a lot of times are offering themselves. Like, they found me on Instagram or on a social media platform. They actually reach out to some of my patients on there, and they have side DM communications saying like, oh, I was thinking about doing lip lift with her. What do you think? And they both come and tell me like, hey, one of your patients reached out. Did she have the surgery? And, like, so they're helping each other. They're building a community. And I think that it's kind of nerve wracking to do elective surgery, and it should be, it's a big deal. And so when they are kind of learning from each other and also seeing the benefits of patients that are, writing reviews or sharing their pictures, they also want to do it. So it's a different conversation than I thought it is, but it's actually, I think that's the most important part, is kind of realizing how important it is for just being comfortable asking. And then if they say no, they say no, and that's fine.
And you know what? Even if 1 out of 10 is say yes, that's still one that you got that you wouldn't have gotten if you hadn't asked. And as much as the doctors are so uncomfortable asking, but you get such a better answer when you ask versus the staff. I would just get used to it and get good at it. And it's always just, would you do me a favor? Other patients, as you know, other patients look at the Instagram photos just like you did, and I sure would like to build up my gallery. Would you do me a favor and let me show off your results because you look fantastic? I always
Yeah.
throw in the compliment, by the way.
Yeah, yeah. I had that conversation today,
Oh, there
and
you go.
and she changed her mind. So it does work.
Right. Right.
Yeah.
Yeah,
Yeah.
they're happy with you, and honestly, I don't know. Like, we can't say everyone's so private when social media has completely taken over our world. That's just not true anymore. Some people still are private, and a lot of people aren't. They're more than happy to share. Just ask.
Yeah. Yeah.
I take it, you're doing a good job on Instagram. You're already at like 10,000 followers. How much time are you spending doing that? And I know you have 2 kids at home. How the
I
heck
have
are
2 kids.
you
Yeah.
doing? Jeez.
I think I probably I'm not spending as much time as I should be. It's like sometimes I kind of get in the mood and I'm like, all right, I'm going to make like a bunch of videos, and then, I'm good for a couple weeks, and then I kind of fall off again. And then it helps to see what everyone else is doing, and some of these like bigger names that are spending a lot of time on high production. And you're kind of like, well, if that person who has such volume and high, they're putting in the time, you kind of get competitive and you're like, all right, I got to do too. So it's plus minus. I would say it's love hate. But I do try to spend some time on it, and I definitely need to start dedicating some time to it, because it really is where the majority of my patients come from. And I think, they like to see me on there too. There was a point where earlier, like a couple years ago, I was using somebody to do like not my face, kind of like, clips from my OR cases or things. And I wasn't really present on it, and it didn't really work. And I was like, I realized when I got back in the wheel, I was posting stories from my perspective and connecting. Like they really like to see that a lot more, or sharing about my personal life. Like they want to know that. And so some of the facelift patients who are older, who are following me, they'll like come in and ask about my kids, and they just really like to see that you're human. And so you can't not spend time on it yourself. Like you can't, have somebody else doing it for you to a degree. You really have to be involved.
Well, it's super helpful if you did get a social media person, and just almost like having a virtual assistant. You just have them come in once or twice a week just to push it, just to make it a priority, and just block some time, just block an hour or two twice a week. And then let them do something with that. There's so much they can film for you and then cut it up and move it into different platforms. It's still you, but a good one can edit very well and just take some of this off of you. But I find if somebody isn't pushing me, I'm reacting to whoever's yelling loudest at me. That's who gets my
100%.
attention.
I like having the other person there. I feel like I shouldn't need it, but I need it. I need the other person
It's so
holding the camera, be
helpful.
like, all right, you got to film today. And it's like, okay,
Yeah.
fine. I don't,
Yeah.
otherwise I'm just spending time on making before and afters, or following up on patients and writing charts. There's just so much to do. So
Right.
you need that person to kind of motivate you to stay on it.
There you really do get, and there's a whole bunch of people out there, doing the side gigs. There's plenty of talent out there. It's just
Mhm.
it's not easy to find the like anything. You go through a few of them, you find one you love. Hopefully, they stay put. Because they can really help you grow. So, any other marketing channels that are working for you other than Instagram?
I have done a couple things like locally, which have been helpful. I did give a presentation at one of our AFPRS conferences. It was the California Rhino Society. And then I also did a talk for the Orange County Dental Association. And so I gave a presentation they kind of like did a kind of a marketing advertising to all their cohort. I think like they have 2,000 or 3,000 dentists in the Orange County community. And I gave a talk about kind of like oral, perioral rejuvenation, lip lifts, filler, like that kind of thing, just so they can get an idea of what we're thinking about when we're looking at the soft tissues around the mouth, and got some really nice kind of relationships built from that, and a little bit of education there. So that was really helpful.
Any consumer kind of events that you spoke to consumers versus colleagues?
No, not so much. I haven't had too many of those where the patients are coming in, not yet.
Gotcha. I did notice though you did an alliance with a dentist. Can you just tell that story?
Yeah, so Dr. Yasna, she's in our building. She has a nice podcast that I've listened to a couple times. And so I kind of just reached out to her and know her through some mutual friends. And I really like her work and her results. And so I think that it goes well together. And I think the thing is, as my lip lift practice kind of built up, I started referring or needing to refer my patients to some dentists because I was like, well, I'm going to do this and your teeth aren't ideal, so we're going to be exposing your teeth in 2 to 4 millimeters or something, depending on how much skin I'm removing. And then you might not like your teeth, you didn't realize that you didn't like your teeth because they were covered. And so that's when, or the other option is if they have long teeth or they already had veneers and they purposely, what they do is they make them long on purpose because they're trying to overcome the long lip. And so now they have these super long teeth and I'm going to go correct their lip. And so I was like, well, you have to find someone to shave them down or someone to make them longer or shorter, that kind of thing. So it goes well together. And that's how I started to think about, okay, I need to find a dentist. And then that kind of turned into something where we offer, to do kind of a joint giveaway for a patient. But we've also kind of shared patients in terms of like lip lift patients who need dental work or dental patients who she thinks need a lip lift and not. And I think educating them about when to do a lip lift and when to elongate the teeth and knowing that there's another option where I've had a lot of patients that come that they're like, I, did this big reconstructive dental work and I really don't like it. And I'm like, well, they made them too long or they pushed out your gums to like get rid of vertical rhytids, which is not the right way to do it. And so there definitely needs to be a good cohesive relationship with dentistry and facial plastic surgery around the perioral area.
So, what was the easiest way to cross promote each other? Did you do in house signage? Did you do an event together? You did the podcast together? Did you do an email blast together?
I think email blast and Instagram. She has a very strong Instagram following, just that specific patient. But I think that doing, like a patient education event would be really nice too. We haven't done that yet, but I think that her following, because of her podcast and her other things that she does besides dentistry, is very strong. And so we had a lot of engagement just from posting it on the social medias.
What kind of a podcast does a dentist have? And what is she talking about? That's
It's like,
interesting.
yeah, it's a very nice podcast. I like it a lot. It's business related, so it's kind of like teaching doctors, it can be dentists or other people, how to market themselves. And so she
Ah.
kind of got big based on Instagram, and so she's kind of it's a more kind of a motivational podcast on how like don't give up. These are stories from my experiences on different things in marketing or operations that can help you have good revenue and not be frustrated by basically all the things that we have to do outside of the actual clinical work. So it's nice. Yeah.
No, interesting. I thought maybe she was interviewing patients or something, but it just, we live in such a visual world. I find the podcasting, like I know some surgeons who podcast, they have a podcast. A couple surgeons there are like three surgeons who group together and they have their own podcast. There are several who do that, but it just seems so visual. I hope they're doing, YouTube as well, because I don't know how to do a podcast if it's not visual, if you're trying to show off rejuvenation.
Oh yeah, it's not to promote. It's not at all to promote her dental practice. It's more she has like a coaching practice on the side where
Yeah,
she
that makes
helps
sense.
like kind of the business development side. So it's more of a business podcast.
Gotcha. Okay. So tell me a crazy patient or staff story that you care to share.
Um, I mean, I guess one thing that as I'm building my practice, I kind of operate at multiple surgery centers. And I think that having staff that's reliable and your own team is really important. One of the things that still haunts me from residency is I was, doing a case, nasal surgery, sinus surgery case, and I asked for local. The scrub tech handed me the local, and I put it in the patient's nose, about to inject, and I looked down and I only saw 1 cc in this syringe. And I was like, why is there only 1 cc? What's in this thing? And it was just straight epi. Could have just flatlined the patient. So luckily I looked down, but the training scrub tech was training another scrub tech. And, that's the person who drew up the medicine. And so for me, it just was a life lesson of, our motto at UCLA was never trust your mother. So just be very vigilant. That was literally every day you heard that phrase in our department. But it just says that, like, going to a surgeon who has their team, they hand selected them, they hand trained them, like all those things are so important. And one of the reasons that you come to a private practice surgeon is because we are creating an environment that is what we want for our patients, what we want for our own mother, basically. And so I train my staff, and the people I work with in the surgery center, like those are all really important versus when you go, using your insurance or your Kaiser or whatever, it's whoever stands there and hands me a 1 cc of epi to inject, into the nose and cause really big problems. So that's something that it's a crazy story. I'm very thankful that nothing happened, but those are, things that can happen that we're trying to control for in private practice.
Can you imagine? You didn't even graduate yet, and there's golly,
Yeah.
my God.
Yeah.
Why don't they color code things or something? Like, I've heard that a couple times where somebody handed them something that was completely the wrong thing, and I think, can't you color code? No?
I mix everything myself. I
Oh,
make all my
yeah.
local myself. I do all the concentrations myself. And that's something I learned from my residency, but also Corey Moss, I did all of it for my entire fellowship. And so that is a life lesson. And that's the kind of training that's really important, is not getting too comfortable, because, these are real surgeries, these are real procedures, and these are really, dangerous things that we're doing. And so those are things that I definitely take into my private practice with me and take very seriously.
Well, thank God you were detail oriented that day. Dear Lord.
Yeah.
Last question. Tell us something interesting that we don't know about you.
Um, I guess I would say that the thing, something that people don't know about me is that I was pregnant during the COVID pandemic. And I was a chief resident. I was doing a lot of trachs in like PAPR suits. And, that was a very difficult time for most people. During COVID, it was a lot of unknown. But I think that that just makes us even more resilient as surgeons and airway experts in head and neck surgery. And so I kind of bring that with me to my private practice, that I'm gonna do the very best that I can for my patients, and always be available.
I noticed on Instagram, I mean, you have little kids. Like, how old are they?
1.5 and 4.
Dear Lord. How are you managing all of this?
I have a very supportive family. We purposely moved here because my in-laws are here, very, very helpful. My mother-in-law is a NICU nurse, and she watches my baby all day. So that helps so much to have, a support network. And, I've known my husband, we've been together for like 14 years. So
Oh,
we've
wow.
really built this together, and he's been through residency and internship and fellowship and all those things with me. And so this is something that's not like, it's expected. And his dad's also a doctor, so he gets it. He's in medicine, but I needed someone who understood what this is going to be, and it kind of signed on for the long haul.
Wow. Is your husband a facial plastic surgeon?
No, he's not. He's in tech. He's a cybersecurity expert.
Oh, gotcha. Okay. I thought he was a doctor. I thought, oh, you should have gone into practice together. Wouldn't that have been
Oh no,
fun?
that'd be great. But no, actually, I'm very thankful. We both are. All my friends that are doctor families, they have like au pairs.
Yeah.
It's very busy schedule. So thankfully, we have one person who's more available.
You're right.
Yeah.
So, any advice you have for others who are coming out now? Anything that you would have done differently that you wish somebody had told you about?
I mean, a couple things is just try and think forward. It's really hard once you get out to build some of the things that you could have already started. So asking for reviews early, starting your Google, profile early, starting an Instagram, trying to kind of market or create a little bit of a niche or a brand early. Those are all things you can still do in training that you don't have to be out, spending money on marketing to do. So that's what I tell most people. And then also, you don't have to compromise or take the first offer. I feel like a lot of times we're a little bit desperate when we're coming out, that, we got to land something. And I interviewed a lot of places, got a lot of offers when I selected my situation, and I really pushed for what I wanted. Most people want to bring you on as an employee. Most
Right.
people, want you to be full time. There's lots of things that you just have to create the practice environment that you think you're going to do the best in. It's going to serve you for the long haul. I know a lot of people who kind of like sign 2-year contracts for 4-year contracts off the get-go in their first practice, and now are like, can't negotiate or can't be flexible or can't even take call and get paid for it. And so those are things that when people ask me, I always talk about, but it's fun, just have fun with it. And the first job is not always the last job.
Right. You're absolutely right, though. Don't get yourself stuck in a corner where you're on the whatever you call that for 2 or 3 year commitments for 4 years. I love the balance. I love what you've done. So if you can do that, do what she did. Do what you did. You've got some flexibility there because
Yeah.
I mean, we're human beings. Nothing ever stays the same. There's always something changing, and it's nice to have some options.
Yeah. I think options are good.
Right. So thank you so much. I just love your name, Ghazizadeh. Yeah, it's a great name. But your patients call you Dr. G?
Dr. G. Yeah.
Yeah,
Mhm.
that makes a lot of sense. So,
Yeah.
all right. So thank you so much for joining me. I will watch your career and see how things are going, but your Instagram is off to a great start. Yeah, good job.
Thank you, Catherine.
Sure. All right, everyone, that's going to wrap it up for us today. If you would so kindly give me a review and subscribe to Beauty and the Biz so you don't miss any future episodes and we can grow our audience. And then if you've got any feedback or questions for me, please leave them on my website at catherinemaley.com. You can also schedule a growth strategy review with me. And then you can also DM me on Instagram at Catherine Maley MBA. Thanks so much, and we'll talk again soon.
The fastest way to success is to model other successful surgeons who have what you want, but you can only see their results, not the path they took to get there. So you continue to jump from one thing to another, hoping to find something that will work for you too. But it rarely does. So try this shortcut instead. It's guaranteed to move you forward. I compiled my intellectual property to grow cosmetic revenues, everything I've gleaned over the years, into one playbook of the most successful practices and what they do to win. Go to cosmeticpracticevault.com and let's grow your cosmetic revenues.